Good afternoon, everyone, and thank you for joining this lightning talk. My name is Kristina Wanyonyi-Kay. I'm a research program leader at this institute, and I'll be speaking to you about a collaborative learning system model. Now, whilst we know that a learning health system is one that's able to learn from the routine care it delivers and improve as a result, the details of how this can be achieved are not as widely agreed upon. This institute is proposing an approach to healthcare improvement and innovation known as a learning system core, which suggests that learning systems require 3 cyclically linked capabilities and 3 assets. So the 3 capabilities a learning system needs are an ability to understand problems, an ability to develop solutions, an ability to evaluate these possible solutions. And the assets that I mentioned are an online collaborative community, co-design techniques, and data and analytics. At the center of this idea is at-scale collaboration, bringing together experts by experience, that is patients and staff, on an online platform, Discovery. So the experts will be hosted on Discovery and be able to contribute to each stage of the capabilities I just described, combining co-design techniques and robust data. The cores will be able to contribute to a learning system. So how do we understand the problem? We want to be able to know what could be improved, what isn't working, and what matters most. So in creating this community of recallable constituents who are key stakeholders, who include patients and staff, one is able to not only understand the problem, but understand it from different perspectives, and also prioritize those problems, establishing what matters the most and what problems are viable targets for improvement. And I suppose the next question is, how exactly can problems be understood? Now, traditional research methodologies are very much on the table in this respect: literature reviews, interviews and observations, surveys, consensus building, functional resonance analysis, all these familiar terms to all of us. In this example from work by colleagues in the Institute, a combination of interviews and observations were used to understand why safety in intrapartum electronic fetal monitoring was so hard. So I'll just move on to developing possible solutions as one of the capabilities of a learning system. So once we've identified the top priorities for problems to be solved, through these cores, we can develop candidate solutions. And co-designing practical tools to improve care is one of the things we can do. So co-design is very much one of the key pillars of this capability. In the example presented here, we can see that the use of vignettes on the Discovery platform were used to establish the ways women and their birth partners could receive communication. And there are several other methodologies that we could use to develop candidate solutions for improvement. Where the evidence exists, we could use that. Positive deviance is very much a potential way to establish possible candidate solutions. This is where we look at services that are performing particularly well in the target area and establishing what exactly they're doing and trying to translate that in a more scalable way. Other ways are human factors approaches, ergonomic approaches, trying to establish whether any proposed solutions that the core, the community might have brought into discussion can actually work in the system and the context which is being discussed. And user-centered design. This is really just ensuring that there's partnership between those end users, the people who will actually have to deliver an intervention, who will actually be instrumental in ensuring their success or failure. So using discovery, stakeholders will be invited to comment and take part in consensus building tasks. And potentially through multiple rounds, we would be able to get to the actual solution that is agreeable to the community, the core community. Other things we're able to do in this phase and through this core community is user testing, actually checking the flaws that might be existent in the solution that's been developed. Pilot testing is also a potential other methodology at this stage. And even operational research could be part of the process where different scenarios are considered and tested out and represented to the community to discuss and reach consensus on. So these collaboration-based methods have already been used to build solutions to specific problems. Again, I share some examples of how healthcare processes improvement were developed through these exact methods remotely and quite rapidly. Prototypes for clinical practice have also been developed through this collaboration-based methods. So I move on to the third capability, which is evaluation. So we want to learn about what works and what doesn't. And using the cause approach, the cyclic capabilities, this can involve process evaluations, rapid randomized testing, and routine data, as well as capturing frontline and patient experiences to inform the core community and develop solutions and evaluate in a manner that ensures the system is learning. So I'm very excited to share our two learning systems projects, which is the Emergency Laparotomy Learning System Community and the Perioperative Care Quality Indicators Learning System Core Community. And we will be very excited for those of you who have interest in these areas and other areas that might come up in as communities to join us, in this learning system approach. Thank you very much for listening.